Hi, hello. My name is Leroy de Heus. I'm a student at Tilburg University and I'm studying/following the master's program of supply chain management. I've done my assignment regarding behavioral decision making of COVID-19 vaccine supply chain echelons at Research Institute Logistics Community Brabant. I'll tell you more about my research in this clip. So the study is research under supervision of Albert Mandemakers, who is currently achieving his PhD promotion. Albert Mandemakers is a supervisor for the Research Institute LCB, which goals to contribute to both science and society by having a deepened understanding of the ramp-up and planning of these vaccine supply chains. This is one of the many innovative themes regarding logistics. Through the LCB network, Albert's network and LinkedIn, various companies are contacted who are stakeholders of the COVID-19 vaccine supply chain. There are already more than 10 interviews available from the last research group. Our thesis circle, so me, Bram and Lieselot, have added 8 more to the total amount. My project in particular is interested into the behavioral decision making of these actors. Behavioral decision making goes into context about decision making process, so operational, tactical, strategic, and how much human behavior affects the decision. In the study, the effect of the behavioral decision is researched in context of the vaccine supply chain performance. Also, the vaccine supply chain performance is impacted by a lot of external disruptive factors, given the nature and impact of COVID-19. So this is a variable which impacts is the study on the relationship. And then why is it important? So on a managerial aspect, every company encounters not optimally made decisions because they are influenced by bounded rationality, which contains bounded knowledge, bounded time and bounded information, but also possible human cognitive biases. To minimize cognitive biases, it's important to map the impact of the external disturbances have on these biases, and how they can be further translated to the performance of the vaccine supply chain. This thesis focuses on the performances, since there's still much uncertainty on 3 different levels. So first, how much time it will take to vaccinate the rest of the world. If possible, new mutant versions of COVID-19 virus will show effect. Since there is still much uncertainty on 3 different levels. So first, how much time it will take to vaccinate the rest of the world. If possible, new mutant versions of COVID-19 virus will appear, or a new epidemic will occur. The research process, the figure above shows the simplified physical supply chain based on COVID-19 vaccines to the Netherlands. The green outlined area displays the demarcated scope of the project, and then the picture below shows the method of researching the phenomenon. So the abductive research can be described as a research approach that lays emphasis on producing new hypotheses and theories based on mostly unknown research evidence, an approach which does not use a stepwise path. The line of reasoning is chosen because of the subject of COVID-19, from which the empirical data will be analyzed, is in many aspects new data. So the time period which the vaccines are produced and distributed in is, in comparison to earlier epidemics, relatively short and on a massive scale. The decision-making process of actors in such a rapid supply chain is therefore vital, and because the research phenomenon is very recent, not much researched. The decision-making process of actors in such a rapid supply chain is therefore vital, and because the research phenomenon is very recent, not much research has been applied to this particular relation yet. For this reason, a flexible approach for both theory and empirical data gives room to develop new directions. Also, the environment regarding the phenomenon is constantly changing, and the study will benefit from this approach. Okay, then we see the variables of the study. So on the left-hand side, the independent variable behavioral decision-making, which contains subvariables, bounded rationality and possible cognitive biases. which are recalled on the figure below. Then on the right-hand side, you see the dependent variable vaccine supply chain performance, which is then underlined by subcategory service level and the amount of research which is deployed. And then if you look at the figure above, you see exogenous disturbance factors, which is underlined by production, demand, and control disturbance. And these are researched to the relationship you see below. The causal relations, so in total 5 primary data interviews, 11 secondary data interviews, and 30 secondary archival data sources have led to the main findings of this research. In the research, 9 total causal relations are given, and 4 of these are shown on this slide. If you're interested to hear the underlying thoughts of these flow streams, you can contact LCB for my full thesis or my contact number. Okay, conclusion, you see above my problem statement of my thesis. Some conclusions I made about this is the amount of behavioral decision making is much represented in the COVID-19 vaccine supply chain. According to the findings, the phenomenon bounded rationality is, in comparison to general supply chains, more represented in this pandemic. So firstly, the constrained time is minimal due to the reduction of clinical trials, late forecast, and supply and demand disruptions. Secondly, the knowledge available in the vaccine supply chain is bounded due to a lack of general logistics from government and pharmaceutical companies. Finally, the information received by actors lacks coordinated data due to a lack of an integrated information system, overall information sharing, and a reactive attitude. However, because of the deployment of control towers, enough information can be shared and coordinated. Besides bound rationality, possible cognitive biases demonstrate enough impact on the vaccine supply chain performance. In comparison to regular supply chains, the degree of external disturbance factors, so there are demand, supply, and control disturbances, have more grasp in the COVID-19 vaccine supply chain. This is mostly because of the societal impact, societal pressure, and the overall necessity of the distributed product to come out of the current pandemic. Then also an interesting finding is the strategy of the vaccine supply chain, so effectivity versus efficiency. Although the amount of behavioral decision making and the disruptions are heavily represented in the COVID-19 vaccine supply chain, this does not immediately trigger a decrease in service level. It does trigger a significant decrease in efficiency of resource deployment. The large expenditure on resources in combination with a shared common goal of the vaccine supply chain leads to a service level of almost 100%. So efficiency is not that important yet in the vaccine supply chain. The importance is given to public health. Then we see some limitations of the research. So COVID-19 is still a sensitive topic for interviewing pharma companies. These companies would only give out public statements and no one-on-one interviews. It's also a sensitive topic for achieving KPI dashboards from all the companies. This would have been helpful in making the analysis to the performance. And third, it would have been a good opportunity to run a survey research to research the cognitive biases more in depth. And furthermore, interpreting the results of the cognitive biases was somehow pretty hard, as you're reviewing them from paper or from behind the computer screen. Plus, also the researcher did not have a background in psychology. And then a few managerial applications summed up. So the establishment of a crisis team with knowledge about supply chain management and expertise in a healthcare supply chain and or disaster environment is essential in creating an effective and efficient vaccine supply chain. The implementation of an integrated information system where all information can be gathered and shared. Optimize the process in between pharma companies and first mile logistics service providers. And finally, it will be helpful to map the decisions and evaluate those decisions. So, thank you very much for your attention. If you're looking for more information regarding my research or you have interest to read my report, please contact LCB. I want to thank Albert Mandenmakers in particular for the guidance and great insights during my thesis project. Furthermore, I wanted to thank Carlijn for the opportunity to start at LCB. And finally, Bram and Lieselot, who were part of the thesis circle, for the great discussions over the past semester.